Okay, it's 1:03. Thanks for coming to the Tuesday, 1 o'clock Eastern Time weekly webinar for BlueStar TeleHealth and for all other interesting things like that. My name is Rob Ray. I'm the CEO here. And today I have three items. One is to introduce some of our team. Two is to talk about items that are on the board. Three is a refresher of the 8 steps. And then I guess we have a fourth thing, which is any questions that you might ask. And when I'm looking down off the screen like that, I'm just taking notes because I haven't figured out a way to take notes on my screen. There's probably a fancy computer that would do that. So I'm going to introduce a couple members of our team that you may or may not have met, so that sometimes when you're talking to them via email or on the phone, you'll know who they are. And I realize Carlos, David, and Alan, that I have you guys as attendees. So David, I'm going to start with you, and I'm going to promote you to panelist, and your face will show up, and then Carlos and Alan will show up. And David, I think I just made you a panelist. There you are. So make sure your video and your audio is on. And David, if you could give them a 1 to 2 minute story about you and your background, then they'll know you that much better next time they're talking to you on the phone or email.
Okay.
And I don't see your video there, buddy.
It's not letting me add video, Rob.
Oh, bummer.
More.
I did. Okay, hang on.
I'm just a lowly panelist. No video for me.
Sorry. But see, when I there's the thing that's not allowing him to do video, but when I scroll up to it,
And that's Preston.
that's up here. See, I got him.
There's usually options for.
Weird, huh?
Yeah. There's usually a setting you can go to that.
Maybe in the main webinar thing, it says it doesn't enable panelists. Okay, well, I guess we should have practiced this before. All right, gang, you will not be able to see David, but he's a very handsome fellow. And David, give us the 2-minute version of yourself. Over.
Okay, I'm waving at you. I don't see any of you except for Rob, but I'm waving at some folks. My name is David Coakley. I joined BlueStar back in March of 2015. So I've been with Rob for some time now, and it's been a great run up to this point. But we've never been so excited to be in the telehealth business. We couldn't get anybody to listen to us when we talked about telehealth a year and a half ago or 2 years ago, and now it's all the rage. So we're excited to be here and excited to have you all part of our team. On a personal note, I'm an entrepreneur at heart. I've been entrepreneuring since I was a young boy. Started with shoveling snow and worked my way up to waxing cars while in college. Then when I graduated from school, I got into the computer industry and ended up starting a business back in, what was it, 1986, called ComStore. We wholesaled PCs back when they were hot and hard drives were 20 megabits. Grew it for about 8 years, sold it to a public company, took over another company for some folks that wanted to sell it in the government contracting industry. It was the first government contractors portal. Built it up over the course of a year, and we were able to get it sold for them at a price that was much higher than what they originally had aimed for. Since then, I've worked for a number of startups. As you can probably tell, I choose my bosses very carefully. They have to be admirals or generals. That's a joke, but Rob's been one of the best entrepreneurs that I've run into, and wished I had him when I was growing, had his help when I was growing ComStore. Father of 4, still have 1 child left at home. He's 18, so hopefully won't be there too much longer. I'm an Army brat, born in Fort Benning, Georgia, and moved to Germany a couple times growing up. So I had an interesting childhood, great childhood. And that's it. Look forward to working with you. And I'm sorry I can't see you and you can't see me, but we'll get it right for the next time.
We'll get it right next time, because hopefully you'll be on future webinars. So thank you, David. Appreciate it. And how many billions is ComStore doing in sales now?
The last I heard was probably 2 years ago, and they were doing over $4 billion a year.
So it's pretty interesting and cool to start a company that's now doing 4 billion, and it's just a shame you don't have any of that stock anymore.
Yes, it is.
Okay, Carlos, over to you, sir. Hit unmute and give the gang the 1 to 2 minute Carlos story.
Hello, guys. My name is Carlos. I am in sales here. I started working in BlueStar back in 2018, and it's about to be my third year here in September. So it's right around the corner. I have a bachelor's of science in economics, and I have prior sales experience in communications, mostly the wireless industry and construction. And if you guys ever need help with any sales support or any sales items, you guys can always come and ask me, and I'm more than happy to help out whenever.
Okay, and tell them about your advanced studies there, Carlos.
I applied to try to get a master's in econ, and I'm waiting on that. And after I finish my economics, hopefully we can do some better things.
Okay, great. We don't have any master's degree in economics around here, so that would be cool. All right,
That would be.
thanks, Carlos. Alan, over to you, sir.
Hi, everyone. My name is Alan Llanos. I joined BlueStar in February of 2017. Wow, time flies.
Yeah.
I know talked to some of you here and there. If you guys ever need any help, you can always shoot me an email. I'll be happy to help. I look forward to working with everyone. I'll be sending out content here and there. Hopefully it helps out. And if you ever have any questions, just let me know. I'll be happy to help. Look forward to working with everyone.
And how old is your son who's no longer a baby?
He's entering the terrible twos right now, and they are terrible.
Great. And what do you do in the evenings and weekends?
Aside from being a full-time dad, I'm also in real estate.
All right. And and your family has the not food service, but what's the service that they have that they provide food for events and other things like that?
Oh, for catering?
Yeah.
Yeah, my family has a restaurant, and
The family's still doing the catering, right?
Yep, that's right, based out of Rockville, Maryland.
Okay, great. All right, thanks, Alan. And last but not least, Patrick O'Hara, fine young Italian boy from New York. Pat, you're on mute there, sport.
How's it going, folks? My name's Pat O'Hara. As Rob said, fine Italian boy. I'm originally from Syracuse, New York. Graduated from Drexel University with a business degree. Also, Army veteran, spent time at Fort Hood in Texas and Camp Humphreys in South Korea. Also worked for Coca-Cola as regional operations in upstate New York. Very happy to be at BlueStar. It's a great company, great people to work for. Rob, Gordon, and
Oops. Hang on, Pat. I just messed you up. Yeah, we gotta practice on this. All right. Sorry, Pat. Finish up your last sentence.
All
But
right.
cut out the part about me and Gordon being nice bosses.
Rob and Gordon, Preston, great bosses. So I'm the telehealth account manager. So you'll be, I'm sure, meeting me soon. I deal directly with their point of contacts for the practices and the RPM organizations. If you ever need help with anything or have issues, if I don't have the answers, I'll find them for you. And I'm a big Yankee fan, Buffalo Bills. If you ever want to talk sports, I'm your guy. So anyway, looking forward to meeting all of you. Thanks.
It's a measure of our inclusionary atmosphere here that we allow Yankees fans to be employees. I just tell him he just can't wear the jacket in the building because it offends my New England sensibilities. Okay, So that's item one. Sorry about the video thing. I think the webinars are set up when we first scheduled them 10 at a time to not allow video for attendees, and I didn't understand that. Point number two is things that are on the board. So I have a big board here over there that's got little magnet things on it. And I took the magnet things down to, I have 3 columns, the key items that we're working, which is on the left, and then the folks that we have delivered letters of intent to, and then the folks on the right are people that have signed letters of intent and that Gordon and Pat and others are working to move them to revenue. And so it's sort of a magnetic CRM, which complements the electronic CRM that we have. But I just wanted to, so here's the stack of magnets that I took down for this meeting. And Citadel Care brought to us by an independent rep. Valley Professionals, FQHC, brought to us by an independent rep. Sulzberger is an FQHC that we did in-house. Center for Geriatrics, brought in by an independent rep. Another FQHC in-house, Alan led that. Merrim Health is an FQHC brought to us by an independent rep. And then Clinch River is another FQHC, which we did in-house through Alan. So those are people that we have sent letters of intent to, and we're waiting for them to be signed. People that have signed letters of intent and are agreed to go forward. Long Valley FQHC, that's an in-house sale through Alan. Johnson Memorial is a hospital, independent rep. Loudon Medical Group, a huge, huge practice in Northern Virginia with hundreds of physicians, independent rep. Dr. Smith in Chicago, independent rep. Langley Health, which is another FQHC, that was in-house. Nest and Care, which is a small healthcare company, in-house. And then Will County, which is in Illinois, an FQHC brought to us by an independent rep. So that you can see that over half, well over half, and I'll have to do the math and figure out the exact number, but it looks like about 2/3 to 3/4 of our opportunities that have gotten to the LOI stage, the letter of intent, or signed, have all come through independent reps. So you folks are doing a good job. Keep up the good work, and it's all paying off. So that's item 2. Item 3 in our fast speed through this webinar, I wanted to refresh on the 8 steps, which we talked about before. And here it is. For those of you that weren't here before, this will be new, but this is up on the web and was sent out to everybody. 8 steps to success in selling BlueStar. Number 1 is get smart. And that means going to our weekly webinars and going to BlueStarTelehealth.com/sales. All the information you need is there. More information than you'll ever want is there. And then if you have any more questions, give me a call and we'll talk as long as you want until you feel comfortable. So get smart. Number 2 is pick your targets. We're finding a lot of traction with community healthcare clinics, which are FQHCs. There's about 1,500 FQHCs across the country, federally qualified health center, but there's about 15,000 community healthcare clinics across the country. There are 6,000 hospitals. There's 120,000 physicians' practices. These are the 3 areas in which we're getting the most traction. So I always say to people, pick a geography, pick 100 targets, and then figure out who in those 100 targets you'll key in on, who will go shooting with a rifle, not with a shotgun. Then select how you're going to talk to them. Are you going to network your way in? Are you going to call on the phone? Are you going to knock on the door? Are you going to send letters? And then figure out what your message will be. And the message obviously is different. Some doctors that are fee for service are interested in making more money. Some healthcare centers are interested in executing on a grant that they received. Hospitals might be interested in extending their outreach out into the community. Then have the brief conversation. Do you employ RPM? And if so, how's it going? And if not, would you like to talk to us to learn some more? And I always say PPP, it's good for patients, it's good for providers, it's good for your pocketbook. And our position is talk to anybody at the practice or the clinic or the hospital that will talk to you, because we've gotten traction starting with receptionists, we've gotten traction starting with doctors, we've gotten traction starting with practice managers. And your pitch is not to sell RPM. RPM is too complicated to sell in one conversation. Your pitch is to sell the conversation with me. And you can do that with a one pager or with a brief conversation, but say, hey, if you're at all interested in RPM, talk to this admiral in DC and spend 20 minutes on the Zoom with him. And you guys can talk about whether it's a fit. And there won't be any arm twisting. There won't be any, we won't be badgering people because we don't frankly have the time to badger people or twist arms. Our goal is to expose RPM and CCM to folks. And if they're interested, we'll follow up. And if they're not, that's fine. Be a salesperson. We need you to follow up. But that's not so much following up after they talk with me. It's the following up in order to get them to talk to me. And I always say, if people are not interested in RPM, just move on to the next people. Because there's lots and lots of practices and lots of opportunities out there. And it isn't worth trying to talk XYZ hospital into having an RPM program if they don't want to. The best thing to do is to go knock on the door or reach out to another hospital that is interested in RPM, and you'll get more done that way. Sharpen the saw. This is kind of sales 101. Be disciplined. Spend a certain amount of time each day and each week. Have a focused target list. Have a focused application that you can do. I can wish that my biceps were 2 inches bigger, but I can't make them 2 inches bigger unless I say I'm going to do 50 push-ups a day. And then I focus on doing the 50 push-ups and the biceps will follow. So in this case, you want to focus on the activities that will lead to those letters of intent, because you can't wish the letters of intent to just occur out of nothing. And as I said at the bottom, when you're bummed out, call us to vent and discuss. Then I said, when I gave this brief the first time, that I think the biggest sale we've had so far from a rep occurred about 30 days after he called up and vented to me for about 45 minutes about how this sucks and how no one's ever going to buy RPM. And, you know, he can't figure out why people aren't paying attention because it's such a good deal. And then boom, later he landed the mega deal. So as you know, you're salespeople, you got to hang in there. And then we talked about examples of people winning customers through email, people winning customers through the phone, people winning customers by going to their friends, people winning customers by mailing hard copies of letters, people winning customers by taking cupcakes into the office and just making friends, and then other people knocking on doors and visiting physicians and physicians' offices face to face and saying those magic questions. Hey, do you have RPM? If so, how's it going? If not, do you want to talk to Admiral Ray? Okay, so that's a brief reprise of Just Do It, a brief reprise of a little conversation that we had a couple of weeks ago, but I wanted to refresh because it never hurts to refresh. And those are the end of my prepared remarks. You know, we like to keep these short. I'm looking at Q&A. One of you asked, can non-medical senior care companies and nursing homes offer CCM? And then David Kimberly said, did David ever live in Ansbach, Germany by chance? I was also a military brat and I lived there when I was in middle school. So we're going to answer that part first. David, I have to promote you back to panelist so you can talk. Because he did live in Germany when he was a kid, I think. David?
Hi, Kimberly. I lived in Germany twice when I think I was 4, 5, maybe 5.5. Then we moved back to the DC area, and then we moved back over there when I was in middle school. So I attended school in Munich, Germany when I was 10, 11, and 12. And at the risk of giving you an idea of how old I am, I lived there during the 1972 Olympics and got to go down and watch Mark Spitz. We climbed up on the outside of their arenas on the structure that was exterior, and they didn't think about all the kids that would be climbing up and risking their lives to watch the events unfold. But it was a great experience. I hope you liked your experience in Germany too.
So David, I will connect you and Kimberly and you guys can figure out, because I don't know where Ansbach, Germany is, but I'll let you guys figure that out. And then Kimberly said, can non-medical senior care companies and nursing homes offer CCM? The answer to that question is, to offer CCM, it has to be prescribed by a doctor, and someone has to be able to bill the medical system. They have to have an NPI number, which doctors have. A lot of non-medical senior care companies do not have an NPI and do not have doctors. Most nursing homes do have an NPI and have doctors. So it's on a case-by-case basis, but CCM is to be reimbursed by CMS. It has to be authorized by a doctor who has billing capability. And most non-medical senior care companies do not have that. Most nursing homes do. And happy to follow up on that if there's any other questions. Okay, and thank you for that question and for that comment about Germany, Kimberly. Okay, it's 1:24. We try to keep these less than a half an hour. Any other questions from the gang out there? As you know, this is where I mentioned humming the Jeopardy theme song. I don't know if I told you my mom was on Jeopardy in the 1960s and was a 5-day champion and won $1,900 in 5 days back in the day. That was when you could only go and be a 5-day champion, and then they sent you home. And I think they used to shoot all 5 shows on the same, Monday through Friday, they would shoot on the same day. So that's my Jeopardy theme song interlude, and I don't have anything else. So with that, thanks again for attending. This will be up on the web. Next time we'll figure out how to show the happy faces of our team, and appreciate all your help. And if we can be of any assistance to you, please keep those cards and letters coming. All right. See you folks. Bye.